Muscle Movements Lecture. The objectives for this lecture are to list and explain the most common types of movement produced by skeletal muscles. First movements we're going to talk about are flexion and extension. Flexion is the movement that decreases the angle between two bones at their joint. We also would just say bending. So bending the arm at the elbow towards the face or bending the knee at a 90-degree angle would be flexion. Extension is the movement that increases the angle between two bones at their joint. So this is the straightening of an arm or a leg. So in the picture here we have flexion in A, where the biceps brachii are contracted or shortened, and the triceps brachii are relaxed, so they are lengthened. And so in B we have flexion where the hand and the lower arm is bent at the elbow towards the face, and extension where we are extending the arm out in full range in the full angle. So in extension, the biceps brachii is relaxed or lengthened, and the triceps brachii is the one that's contracted or shortened. This slide shows the flexion and extension of the leg. So in A, the quadriceps femoris group is relaxed and lengthened, and the hamstrings group is contracted. In B here we have extension where our leg is straight, the angle is maximized, and flexion where the knee is bent and the angle is decreased. In C we have the extension version where the quadriceps femoris group is contracted and the hamstrings group is relaxed. So other types of movements we have abduction and adduction, rotation and circumduction. So abduction is movement of a part away from the midline of the body. So for example, raising your hand or raising your arm outward from the body. Adduction with a D is the movement of a part towards the midline of the body. So your arm is at the side of your body. Rotation and circumduction is the movement around a longitudinal axis. So for example, rotation of your head from side to side. Other types of movement we have supination and pronation. Supination and pronation originates from the words supine and prone. So if these terms look familiar, that is why. So supination and pronation are hand positions that result from rotation of the forearm or the radius bone. Supination results from in a hand position with the palm turned to the anterior position. So this means that the palm of the hand is turned facing up, and pronation occurs when the palm faces posterior, so the palm of your hand is facing down. Dorsiflexion and plantar flexion foot movements. Dorsiflexion results in elevation of the dorsum or the top of the foot, so your toe is pointed up. During plantar flexion, the bottom of the foot is directed downward, so your big toe is pointing downward. So here are some pictures of each. So abduction with a B, hand raised. Adduction, hand at side or arm at side. Rotation of the head, so looking both ways. Pronation, palm is down. Supination, palm is up. Plantar flexion, toe is down. Dorsiflexion, the big toe is up. And then we also have inversion and eversion. Inversion is where the toe is rotated up and the foot is on its side. Eversion is where the big toe is rotated down and the foot is on its side. So muscles of the head and neck. There are several facial muscles that we will talk about first. We have the orbicularis oculi, which is the big muscle around our eyes. The orbicularis oris, which is our kissing muscle, which is around the orifice of our mouth. And then the zygomaticus, which is our smiling muscle. These are the main muscles and some of the larger muscles in our face. There are several other muscles that are present, but these are the major ones. Muscles of mastification or chewing. We have the masseter and the temporal muscles. These two muscles are some of the strongest muscles in our body. They are some of the most widely used muscles. The sternocleidomastoid flexes the head, and the trapezius elevates the shoulders and extends the head. So these two muscles are responsible for our head rotation and they attach our skull to our neck and into our shoulders. So a general overview of the body musculature. For your tests, you will want to study this in depth. Your test is multiple choice for these, and what I will do is I will give you 4 muscles and I will say pick the one that is not in the quadricep group, or pick the one that is in the shoulder, or pick the muscle that is in the hamstring group, and you will have to pick those out in a multiple choice fashion. So I will go over this. Here we have our facial muscles. You can see our sternocleidomastoid and our trapezius up here on the neck. Our pectoralis major is what attaches our upper extremities to the thorax. So that is a very important muscle, oftentimes a very large muscle. Our deltoid muscle is where we give our intramuscular injections to adults. So that is of note. We use this a lot in the medical assisting and nursing world. Biceps brachii, brachialis, and then you will want to pay attention to your abductor groups and your quadricep groups. The vastus lateralis is the muscle that we try and inject in small children for intramuscular injections. And then we have the tibialis anterior, which is the main muscle that is the culprit when we have shin splints, along with the peroneus muscles, which can also pertain to shin splints depending on if it's on an anterior or lateral or medial side. So depending on where the shin splint actually is. Our gastrocnemius is what we call our calf muscle often. Soleus muscle is in our leg. And then we also have our fibularis longus and brevis muscles in the backs of our legs along our Achilles tendon, which is right in here. And then on the back side we have our gluteus maximus. Sometimes we will give our injections in the gluteal minimus muscle, or not quite in the gluteus maximus, but up here by the ilium. And then we have the latissimus dorsi, which is one of our largest muscles in our back that helps support our spine. So the next slide here is the muscles of the head and neck. We have our frontal muscles. As you can see, the masseter muscle is one of the largest muscles. It connects the upper and then the lower jaw here and helps with our chewing motions. Then we have our pectoralis, or our upper extremity muscles. Our pectoralis major flexes the upper arm. The latissimus dorsi extends the upper arm. The deltoid abducts the upper arm. And this is often used for an injection site in adults. The biceps brachii flexes the forearm, and the triceps brachii extends the forearm. Abdominal muscles, we have the rectus abdominis, which flexes the spinal column. Our external obliques and our internal obliques, which are on the sides of the abdominal region, and then the transversus abdominis. We also have respiratory muscles, such as the intercostal muscles and the diaphragm. They change in size. They change the size of the chest during respiration. Both of these do. Muscles of the trunk. There are several muscles of the trunk, and as you can see, there's the obliques on the side. And in A here, this is the outer portion of the musculature group, as you can see. And in B, we have removed the top layer of the musculature, and this is what we see underneath. And you'll see the transverse abdominis as one of the more major groups under, and the internal obliques, which is under the external obliques and other abdominal muscles. Iliopsoas is one of the muscles of the lower extremities, which flexes the thigh, but can flex the trunk if the thigh is fixed or immovable, such as when we do sit-ups. The gluteus maximus it extends the thighs. Adductor muscles adduct the thighs, and our hamstring muscles flex the leg. So in the hamstring muscles, we have the semimembranous and the semitendinous and the biceps femoris muscles. The quadriceps femoris group extends the leg. We have the rectus femoris and the vastus muscles, which are the main muscles in the quadricep group. The tibialis anterior dorsiflex the foot, and the gastrocnemius plantar flexes the foot. We oftentimes will call this the toe dancer's muscle. And the fibularis, so the peroneus group, flexes the foot.